Good afternoon to you all. My name is Chris Deerin. I'm Director of Reform Scotland, and welcome to today's discussion, which is the latest in our ongoing and, I'd like to believe, influential NHS 2048 series. And today we'll be talking about an issue around healthcare that could barely matter more, that could barely be more complex and entangled, or be harder to fix. Health and healthcare in Scotland are in a fragile position and seem to be becoming more fragile by the day. I would argue there's maybe not enough sign yet that the Scottish Government understands the precariousness of the position, or that if it does, that it's facing up to it with the requisite courage and determination and focus. Maybe I'm wrong about that. Views will differ, but perhaps we'll see movement in this week's programme for government. But from what I hear, any proposed changes will be minimal at best. We also don't yet know, to be fair, whether the opposition parties have the mettle to step up in what is a crisis and is going to become a greater crisis if one of them becomes the government in place of the SNP in 2026. But we know someone somewhere needs to step up. We know that the NHS is struggling, but we also know that there's more to national health than the NHS, and that's where Public Health Scotland comes in. The organisation was set up in 2020 with a remit to look across the piece at the health of our nation's people. Scotland famously has historical problems around heart disease, cancer and life expectancy that are perhaps barely credible in a first world developed economy, and we certainly don't seem to have made as much progress on many of these areas over the decades as we might have expected to. I think Public Health Scotland's existence is an attempt to understand and address this and more, namely by improving life expectancy and reducing health inequalities, which are its two key goals. And it does this in a fascinating variety of ways. It's an NHS board that uniquely is sponsored both by the Scottish Government and the Convention of Scottish Local Authorities. It has a strategic partnership with Police Scotland. It works on local community planning and collaborates to address national outcomes on child poverty and drugs deaths. So for these reasons and more, it has a central and distinct place in the current national debate, where the funding of the NHS is putting a real strain on the straitened public finances, and where issues such as child poverty and drugs deaths are really far from the headlines. Today's guest, Paul Johnston, is the Chief Executive of Public Health Scotland, a post he has occupied since March 2023. Paul, if you'll forgive my journalistic shorthand, might be the very definition of a civil service mandarin. Prior to joining Public Health Scotland, he spent 8 years as a member of the executive team and corporate board in the Scottish Government. His responsibilities covered many areas of social policy that impact on health. He was Director General for Education and Justice between 2015 and 2021. He became Director General for Communities in 2021, with responsibility for tackling child poverty, social justice, social security, housing, equality, human rights, local government and public service reform. So no big challenge there. And he has also been a director in the UK government. Now, I use that word Mandarin because it usually has connotations of wisdom, of course, and I'm sure we're going to hear a lot of it today from Paul. So welcome to you, Paul. Thank you for joining us.
Thank you, Chris.
Now, just before Paul and I have our chat, be very grateful if you would send any questions you have. I've looked through the attendee list today, and it's full of people who are working in sectors and areas that have a relevance to the work of Public Health Scotland, and also lots of smart and engaged observers. And we'd be very, very keen to take your questions for Paul, as I say, once we've had a chat. If you can just make sure you're all muted while Paul and I talk, so that there's no background noise. So Paul, first, I've got a very basic question for you. What is the state of Scotland's public health in 2024?
Well, Chris, can I just thank you for the invitation to speak at this event, and can I say to everybody who's joined, delighted to have this opportunity to speak. And as you say, Chris, I'm looking forward to some really good questions. That will certainly make for an interesting session, I'm sure. And while, yes, I guess I can't escape your description of being a civil servant for many years, nor would I want to. I'm delighted with the opportunities I've had to work in the Scottish Government and the UK Government. Let me just say that Public Health Scotland as a health board is that little bit apart from government. I am no longer a civil servant. I'm no longer bound by the Civil Service Code. And with that comes the opportunity that civil servants don't tend to have, really to engage cross-party, and particularly with Public Health Scotland's accountability to COSLA, the Convention of Scottish Local Authorities. That really takes us into that broad political sphere that local government represents. And I think that's important because, Chris, one thing is sure, if we are going to secure real progress with Scotland's health, that's going to take all of us, and I think it's going to take different political parties to really come together and work together. In terms of Scotland's health overall, you'll hopefully have seen my description, my kind of broad brush description in the blog that I wrote for your really important debate that was published in April. And that points to the challenges that we're seeing with the health of Scotland. We've seen life expectancy stall, and sadly, we've seen health inequalities increase. But there's one figure that I keep coming back to, and really it's in my mind day and daily working in Public Health Scotland. And it's the number of years of good health that our citizens across Scotland currently enjoy. And Chris, you and I had a word about this when we were speaking before the event. And so I just want to really set out the figures. The most recent figures from NRS show that the poorest males in Scotland, that's 20% of Scotland's males, now expect only 44.9 years of good health, and then have 23 years, just over 23 years of poor health before an overall life expectancy of around 70. By contrast, the wealthiest males, the 20% wealthiest males in Scotland, experience 71 years of good health before about 11 years of poor health. So just to dwell on that for a minute, you've got a gap. This is what we mean by health inequalities, right? A gap in the healthy life expectancy between the poorest and wealthiest males in Scotland of more than 26 years. That's where we're at in terms of health inequalities. And our poorest males are then experiencing around a third of their life in ill health, with two really powerful consequences of that, maybe three. First, in fact, there are three. First, the impact that's having on individual well-being. Secondly, the ability to work and contribute to the economy. And third, the inevitable need for support by our NHS during those years of ill health. So, Chris, I feel that there's lots we could say about Scotland's health, but I did want to just start by dwelling on those figures. 44.9 compared to 71, 23 plus years of ill health compared to 11, and ultimately the poorest males in Scotland dying while the wealthiest are still enjoying their years of good health, right? That's a stark position. The position for females is a bit better. It's 47.4 years of good health compared to 72.3 years of good health for the wealthiest females. So it's not as stark, but it's still very stark. And basically, in PHS, we exist to work towards the whole range of approaches that are needed to address that picture, Chris, and to see improvement in Scotland's health. But of course, we cannot do that ourselves. That requires really an endeavour across the whole system.
And those figures are staggering and really quite shattering. Do we have sort of international comparisons about how Scotland ranks against whether it's other similar economies, developed economies, or in general where we sit in the overall international charts?
We do, Chris, and I'm afraid we do not fare well. We can point to some other countries that do less well than we do, but in terms of our normal comparator countries, put it this way, we are lagging behind others in the UK, although the trends are similar across the UK. And when we look at other European countries, we are lagging behind. We're lagging behind most, and particularly that level of inequality, I think, is a matter that needs to concern us, both in terms of the ability of individuals to fulfill their potential and have a long life marked by good well-being, but as I say, in terms of that contribution to the economy, and in terms of the demand that's inevitably placed on the public services, which I know Reform Scotland has been keen to focus on through this debate, then we can see we've got a real issue. But I suppose as we look at other nations, Chris, and we see that other countries are faring better, in some ways that is a source of hope. In fact, I point to two sources of hope here. I'm not gloomy. I'm not here to say there is nothing, no hope, nothing we can do. Firstly, we can learn from other places in terms of approaches that have worked to tackle inequalities and to improve health. And secondly, we can look back and we can see that we have seen progress in the past. And so we can see it again. And indeed, we're seeing progress through some current work that's underway that hopefully we'll have a chance to discuss. And that's where I'll get on quite quickly, I hope, to say a bit more about prevention. The fact that ultimately we cannot simply focus on responding to the current issues. I do not think that will be a sustainable way forward, to think that somehow or other the NHS needs to get better at responding to Scotland's health. We must have a focus on preventing the current level of ill health that we see.
And I started off by saying, that I think anyone who grew up in Scotland over the 70s, 80s, whenever it was aware that Scotland had some fairly deep-rooted problems with alcohol and smoking and maybe some of the industrial consequences of the jobs market and poverty. I do wonder, given our low place on those charts that we talked about, if other countries have, in a sense, made a better job, because we wouldn't have been alone in some of those things. Is our position largely based on the fact that we started from quite a low point, or have we been a bit outstripped by other countries that maybe have got onto prevention or a healthier population faster than we have, or more effectively than we have? Have we been a bit slow to really make progress in those areas?
It's a good question, Chris, and it's a challenging question. And in reality, I think the answer is a bit mixed, because I can point to some areas where the evidence would say that in Scotland we have been bold in taking action that has led to improvement in Scotland's health, right? So I'm not going to say for a minute that we've been in any way been behind other countries on a consistent basis. So if I look to Scotland leading the way on the ban on smoking in public places, for example, we can see that as an example of bold action that's delivered results. If we look at minimum unit pricing for alcohol, which has been subject to 5 years of pretty painstaking evaluation, some of which was, or much of which was led and coordinated by Public Health Scotland, we are clear that minimum unit pricing for alcohol has contributed to reducing deaths and reducing demand on the NHS. I think what we are grappling with still in Scotland are some of the social and economic factors and problems that are contributing hugely to Scotland's health issues. So broadly speaking, if you look at what makes for health, the evidence from the King's Fund in particular would say that about 40% of what makes for health is the social and the economic environment that you grow up in. So it is actually very significantly about money and about work and about family income. And about 30% is about the health behaviours. So it is actually about obesity, food, drugs, alcohol, and tobacco. About 10% is the physical environment, and about 20% is the health services that we experience. And we know, as you've alluded to, Chris, that in Scotland we do have particular issues with drugs. We see drug deaths still persistently higher than other countries, despite I see a huge effort to tackle that. And we do still see an ongoing level of economic inequality that I think is driving that, at least a significant part of that poor health.
So just thinking about Public Health Scotland, it's 4 years or thereabouts in existence. And the problems we're talking about, many of them are decades in existence, perhaps longer than that. And, you know, it's such a broad canvas that you're being asked to play on. You're having to work with so many other different organisations. Probably I'd struggle to get out of bed in the morning having to face all of that and be accountable for making a difference. Could you talk to us a bit about what the processes are for Public Health Scotland, what you've been doing, who you're working with, what kind of projects you've launched, any successes that have come about over the last 4 years, or certainly that are underway, if it's not to ask you to achieve too much too quickly?
Thanks, Chris. Well, it's a great place to work, and I highly recommend it if anybody's thinking about a career that involves Public Health Scotland at some point. And I am very lucky to work with a great team. One of the things I enjoy is the way in which we bring together people from a whole range of backgrounds. So we've got nurses and doctors in the organisation, quite a number of consultants in public health. We've got data analysts and we've got scientists, so and many others. Really working together to try and make a difference for Scotland's health, working in partnership with Scottish Government, local government, others in the NHS, and wider partners, including business and third sector. And there are many areas where we look and we can see progress. So a lot of the organisation, Chris, over the first 2 to 3 years of our existence was very focused on the COVID pandemic. And we've been giving evidence to the inquiry on that, and I certainly feel real pride in the work that colleagues across the organisation did to support Scotland through the pandemic. We were formed in March 2020, and I think that's a month that will be well known to all of us in terms of the pandemic really hitting us at exactly that time. So I think rightly that a lot of work and a lot of people were devoted to that. Areas that I think we can see as actually providing quite early examples of success include our work on vaccination. And one thing, Chris, that I always challenge is an assertion that we're not really doing anything in a preventative space in Scotland. That is not true. Vaccination is one of the best examples of prevention in action. And within Public Health Scotland, we run Scotland's vaccination and immunisation programme, again, in partnership with other territorial boards, but we're responsible for the oversight of the programme. And what we're seeing is that our vaccination rates in Scotland remain higher overall than the rest of the UK. And so that's something I think we can be pleased about. We know that is preventing huge amounts of ill health. It is preventing what could be enormous further demand on the NHS. And it's something we really need to work hard to maintain, because there are real pressures, and we have seen overall rates of vaccination decline, still, as I say, higher than elsewhere in the UK, and we're very, very keen to see those rates increase. We also have an important role in producing a very wide range of information, weekly stats about the performance of the NHS, but we're trying to go beyond that. We don't simply want to produce the statistics. So we're involved in the whole area of healthcare public health, which is really working with providers of healthcare, taking those statistics and seeing how we can support improvement. So, for example, we work with boards to provide them with comparative information about what's going on across Scotland, with a view to trying to ensure that wherever possible, we can identify areas that are less efficient and really seek to ensure that, that health boards are delivering the most efficient and effective healthcare they can. So there are a couple of examples, Chris, but we've still got an awful lot to do. So I do not wish to overclaim in any way. We feel we're on a real mission. We are on a real mission to work with our partners to get health inequalities and prevention much more on the agenda, because we feel it's an area, we know it's an area based on the evidence where we can see progress for Scotland's health.
Well, which leads me on to my, excuse me, on to my next question. So one of the reasons we're running this NHS 2048 programme is that we know the NHS is hugely in need of reform. And, you know, that wasn't just us coming up with that. That was speaking to medics organisations. I don't think anybody out there thinks that things are going quite as they should. But a big part of reforming the NHS has to be in reducing demand, which means improving our general health. I suppose, though, against the current backdrop of shrinking budgets, we sometimes see that it's the prevention programmes that are first to be cut, perhaps because they're the easiest to just lop a line off a budget. So how do we simultaneously pay for that firefighting frontline work that's badly required while also paying for the much needed prevention? How do we advance the cause of prevention at a time when budgets are incredibly tight? Are we now looking at effective and low cost ways to address behavioural change, or how do we do it when, you know, basically governments on both sides of the borders are in pretty severe fiscal trouble?
Yeah, thanks, Chris. We've got no option really other than to work very hard to increase our prevention focus just now. No option other than to do it. Because the reality is that we cannot afford to continue to deal with the entirely preventable harm that the NHS faces day in, day out. And so I'm really encouraged by the fact that the Scottish Government, in setting out their vision for the reform of the health and social care system, have put prevention at the heart of their approach. That was set out by the Cabinet Secretary to Parliament, I think just towards the end of June of this year. Prevention and improving the health of the population right at the heart of the vision. So I think that's really encouraging. And we are now working with the Scottish Government on a long-term approach to actually delivering on that vision. I think it's also encouraging to see the way in which the UK government is recognising that the prevention of harm has to be an integral part of what we do. And in reality, as I think you allude to, Chris, the good news for policymakers is that prevention does not always cost a lot of money. There are some preventative measures that are expensive, so I'm not for a minute suggesting that it can come cheap. Probably the best preventative intervention that we could have in Scotland would be for everyone to have adequate income and where they can work to have a good job. But we know that that's hard, and that, for example, there are pressures on our social security system. But let me give you maybe just a couple of examples of preventative measures that don't necessarily cost a lot of money. So measures taken on alcohol, things like minimum unit pricing for alcohol, measures taken to reduce the harm that alcohol, drugs and tobacco cause, do not need to cost very much at all. I'm hoping we might have a chance to talk a bit in this session on what we're seeing in Scotland on overweight and obesity. Mm-hmm. We're now around 67 in every 100 adults is dealing with overweight and obesity. And there are ways in which we could see preventative action there, Chris, particularly by focusing on what we're experiencing in our food environment. There are things that could be done there that do not cost a huge amount of money. And actually, if we can support employers to provide good work and to support people to stay in work, then there can be a real win-win. Yeah, so we can have individuals who are better able to work for longer and healthier, with less demand on the NHS, and crucially, better able to contribute to the success of the enterprises that they are working in. So we recognise the pressures that government is under, absolutely recognise it. And so we're really keen to identify, I suppose, the smartest preventative interventions that can be taken at this time, and to see where we can generate real support for moving ahead with them. And that's where I hope that Reform Scotland's discussions can help us secure further progress.
Well, since you've mentioned obesity and those, again, very worrying figures about the number of people who are dealing with obesity-related conditions, I suppose when you talk about the food producing industry or whatever, the government in Scotland has it's talked about doing some, fairly invasive things. It's backed away from them really when it's come to it. What's your view about what we should be doing given the scale of the challenge? Has your view changed on this? Do you think we should be being more aggressive? Do you think we should be about incentivizing, or is there something like the heavy hand of the state needed to come in and basically legislate to change the producer behavior so that then changes the consumer behavior?
Yeah, you'll probably not be surprised to hear, Chris, that in some ways what I think we need is action across a whole range of areas, right? One thing I've been learning very clearly in my year and a bit in Public Health Scotland is rarely is there a single solution, one thing that will solve the problems that we are grappling with, in the same way as a complex range of factors are shaping Scotland's health, as we've been discussing. Similarly, a wide-ranging response is needed to improve Scotland's diet and weight. But let's be very clear that a response is needed, that currently what we're seeing is a rapid rise, and this is a pan-UK picture, but we are seeing a rapid rise in overweight and obesity to the point where, as I say, 67 out of every 100 adults are experiencing that. The numbers for children are lower, but are growing significantly, and that's a matter of real concern. And a significant number of life years are being lost at present due to the issues that we're experiencing. In July, we published a position statement alongside directors of public health that we can probably link to in the chat for this call, Chris, which sets out the range of actions that that's Public Health Scotland and the directors of public health from every health board in Scotland think needs to take. And it does include working with those who are producing food. We've already seen some real progress on reformulation, on reducing salt and sugar, and we need to see a lot more action there. So this is not about working in any way in opposition with food producers. We want to work and need to work with the food industry to see where reformulation can help. We also need to see food producers and retailers play their part in promoting choice. We need to see individuals having truly a choice whereby healthy food is as readily available and affordable as unhealthy food. And the reality is that at the moment, particularly in areas of greater deprivation, that choice just doesn't exist. It's unhealthy food that is promoted and that is available, and healthy food is costing so much more, and in many cases is hard to access. And so currently those with the lowest incomes would have to spend around 50%, 50, of their disposable income to eat a healthy diet, compared to only 11% for those with the highest income. So basically, healthy food is costing a lot, whereas unhealthy food is often the cheaper. So what we've done working with Food Standards Scotland is also published a position paper on this. We support the Scottish Government's proposed measures on high fat and salt and sugar foods. We have contributed to the government's consultation, as I'm sure others have here, and that consultation is now closed and we know is being given active consideration by the government. I do think, though, that it's an area where we would benefit from strong action across the 4 nations of the UK. And actually, England and Wales have taken some measures on high fat, salt, sugar, such as the positioning of foods, where I'm sure action will follow in Scotland. But we are keen to see bold action on improving the food environment right across the UK. It's not the only thing. We also need to see people have access to effective weight management support and effective weight management services. We know there are a range of interesting clinical options and medications that are increasingly coming onto the market. But from a preventative point of view, Chris, we would say, let's not simply try to get involved once this problem has occurred. Let's play our part in supporting individuals to maintain a healthy weight, to enjoy the benefits of a healthy diet, with all of the health and well-being benefits that that brings.
So you've talked, with some force and at times a bit euphemistically there about the need for action to be taken. Can you be more specific about what you think needs to be done? You mentioned some measures that have been taken south of the border. What are the 2 or 3 things the Scottish Government could do that would address this inequity and the lack of access to almost self-managing your health because you happen to live in an area that perhaps doesn't have those, or an area where you're spending much more of your income on to have a decent balanced diet?
Yeah, so one specific that we want to see action on is work with our local authorities and our community planning partnerships on the whole area of licensing, so that we can see a better spread of food outlets right across Scotland. There are times where what we've got is a concentration of unhealthy food options, including roundabout schools. And so we need, that's one of the things I mean when I talk about the food environment shifting, so that we can see a better balance. By contrast, I spoke to an individual in an area of Glasgow recently who was telling me that she now had to take 2 buses in order to access a supermarket where she could get healthy foods. So is it any surprise that individuals are finding it hard to access that food? So there's something about the location of healthy foods outlets right across Scotland. There's absolutely a piece around enhancing our partnership with food producers and retailers, so that the healthy choices are the ones that are increasingly available and attractive and affordable. But as I say, I suppose thirdly and finally, we do support government taking legislative action in this area, which in some ways helps ensure a level playing field. So that, for example, we don't have the multi-buy promotions on the really unhealthy options, we've got them on healthy options. And we think that's the sort of measure that's needed to see a shift away from encouraging people to get more than they need of the unhealthy options, which are contributing to these health and well-being issues, towards actually incentivizing healthy options. And I think it's a mischaracterization to describe that as government interference or nanny state. I think that's about recognizing the problem we've got with health, recognizing the harm that is causing for individuals, for children as well, recognizing the pressures that our health service faces, and taking sensible preventative action.
And it's not just about access to retailers that are selling healthier food. Sometimes it's about the lifestyle that people have. Sometimes it's about the pressures that they face in their life, what they're dealing with day to day, where they maybe have less time to think about the kind of diet that they're able to pursue for them or for their children. We know, and I'd be interested in your views on this, that there still seems to be something of a blame culture around, where if someone is overweight and gets type 2 diabetes, it's regarded as their fault. And I do wonder whether we take into account enough the pressures that people who are maybe living what we might term more underprivileged lives, that have less disposable income, that have all sorts of issues to deal with in their families and in their communities, whether, it's not just about providing them with access to a retailer, it's also about lifting them out of the situation that they're in. But we've been trying, the poor are always with us, we've been trying to do that for as long as that really there's been a developed society. So it's pretty difficult to get from where we are to where we want to go. And what do you think is a realistic focus, a realistic ambition in all of this, so that you can say, actually, we have made proper difference? It's, we talk about child poverty and all the rest constantly just now, but that sense of that as a society, we're quite judgy about people who end up in these situations, or we maybe don't understand the pressures that they face that the middle classes don't necessarily have in their own lives. Yeah. Is that something that's led by rhetorical arguments from the centre of government? Is it the media? What would your thoughts be on that?
Yeah, Chris, I think it's really important that we work to avoid stigma in a way that will just make problems worse. So that's why I've focused less on individual choice, although I think I see a question coming up that was something about, are people being skilled in nutrition and food and cooking meals? And I think there's absolutely a place for that. There's a place for education and for upskilling there. So I think that's fair. But when you just look at the data, so much of our problem with obesity and overweight keeps leading you back to the environmental factors rather than the personal choices individuals are making. Hence why we think the focus needs to be on concerted action to sort out the food environment that individuals are being confronted with day in, day out in Scotland. And that's an area where we can learn from others. We can learn from other countries, where we're not talking about banning things. We're talking about giving people better choices so that healthy options are as readily available, as attractive and affordable as unhealthy options. And in terms of what's a realistic aim, well, we need to start by reversing the current trends, Chris. We've seen this steady increase in the levels of obesity and overweight. And it's not the only thing. We've seen increases in other areas as well. I'd like us to be hugely ambitious around the change that we will see over the coming decade in that healthy life expectancy figure. And we're working with other colleagues in Scotland, and we're also working with Michael Marmot, a leading public health expert across the UK and indeed across the globe, really to try and say, okay, well, how far could we get over this next decade if we were to put our shoulder to the wheel and really focus on prevention and on improving the health of our population? We'll have more to say about that in the weeks and months ahead as we take forward our partnership working with Michael Marmot and the Institute for Health Equity that he leads. But let's be clear, if we work together, we can see some real progress here.
Okay. Well, I'd like to move on to questions. We've still got a fair bit of time, but it does seem to be quite a popular issue in its broadest sense for questions. And Ewan Brown, who was in there first and looks to have a question that's something of a challenge. Ewan, do you want to ask your question?
No, I was just wondering, I mean, you said, Paul, you'd come out of the civil service. I have no idea how many civil servants are still involved in the work that you're doing and whether there's any kind of duplication here. But my specific question was, what is your budget and what percentage of that would be devoted over the next 12 months to prevention?
Yeah, thanks very much, Ewan. So we, as you'd expect for any public body, our accounts are all published. And so our annual budget has varied quite a bit over the years because we did more on COVID and then we obviously are now doing less than that. So in round terms, think around about £100 million. So in terms of health boards, that's among the smallest of the health board budgets, but it's a very significant amount of money. Just over 1,000 staff in the organisation. Many of them are in the data and digital side, Ewan, where they are publishing that whole range of information about the NHS and its performance. And you raise an important point about avoiding duplication. That's very important. So we've got regular dialogue with Scottish Government about where they will be working on an issue. And if they are, then that's not for us to lead on, and where we will be leading on an issue. And so to give you one specific example of that, we, over the last year, have taken on significant additional responsibilities in relation to vaccination and immunisation. And at the same time, the Scottish Government has been able to reduce the numbers that they have working on that. But that's a live conversation that continues. The other area, another big area of work for Public Health Scotland that I haven't said so much about is health protection. And although the pandemic has passed, those on the call, I am sure, will be mindful of the range of health hazards that continue to face us. Mpox is one of the latest, and quite a number of colleagues in my organisation are working on the whole range of health protection incidents that exist at any time in Scotland and work very closely with the UK Health Security Agency there. And that's another example of we're doing that work. We're then liaising with Scottish Government, but we're not duplicating. We're reporting into them. We're the ones that are leading on the coordination of those health protection incidents.
Okay, Ewan? Yeah. Just a quick comeback on that, Paul. We didn't touch on technology, but it is an area of great interest to us at Reform Scotland, and whether it's about monitoring potential outbreaks or also in terms of protecting people's health on a day-to-day, weekly basis when maybe people have had some kind of health condition, ensuring that they don't end up developing, further down the road, or it recurs and we don't catch them until late, and all the pressure that then puts on the NHS. Do you see technology being transformative in the space of tackling some of the issues that we've talked about today?
Yes, Chris, there's huge potential there, huge potential. And we're already seeing some of that being realised. So, for example, prevention of type 2 diabetes, for example, where approaches are being tested out around wearable devices that will support people in managing their health. And we need to go further there. We need to go faster on that as well. And at the same time, we need to really watch out, Chris, that we're not going to widen health inequalities. So we know that already those with the money and resources can benefit from some of these, and of course are benefiting from them. What we are keen to see is that there's really widespread benefit, and indeed those who are currently experiencing the sort of health inequalities that we've talked about are also able to benefit from the tech that's coming on stream. And we're absolutely working with Scottish Government and academic institutions in that area.
Okay, thank you. Matt Smith-Lilly, you want to ask your question, Matt?
Good afternoon. We'll try again there with the mute button. Yeah, thank you. So I work for the British Association for Counselling and Psychotherapy. We represent 70,000 counsellors and psychotherapists working across the UK. I guess one of my questions always is how is public health, how are we looking at preventative strategies to help people manage their mental health more effectively? Increasingly, we see, presentations at GPs, more and more of those are mental health related. And it starts to become a kind of a bit of a vicious cycle for people where mental health problems may be caused by social or physical challenges they're facing as well. So I'm just wondering what maybe emphasis or what work you've got in the pipeline to help tackle some of those causes over the next few years.
Yeah, thanks. We absolutely recognise that growing burden of ill health through mental health issues. And I think we see it particularly starkly when we look at what's going on around Scotland's economic inactivity figures, where, as I'm sure others on the call will be aware, we're seeing a growing rate of economic inactivity. That's people who you would probably expect to be in work, not working, and citing ill health as the reason for that. And that's where mental health issues are seen really, really strongly. So one area where we're active, as well as shining a light on the evidence, we are working in partnership with Scottish Government and local government through our cross-organisational programme of work on mental health and wellbeing. Very practically, that includes some support for employers through our Healthy Working Lives site. So we are available to provide support in that, I suppose, preventative space, actually. What are the actions that employers can take to promote well-being, to promote a flourishing work environment, so that individuals are actually supported with their well-being and able to stay healthy and well at work. And I mentioned that perhaps I realised I didn't answer Ewan's question about the percentage of our budget that's allocated to prevention. It's a tricky question, and it's one that we are grappling with. What I want to see is more and more of our resources being devoted into a preventative space. And I think mental health is an example of where we can focus our work in prevention, recognising that it'll be other parts of the NHS that are particularly focused on treatment. If I talk about our vaccination work, then that's largely in a prevention space. But some of our work, particularly our work in setting out the statistics that describe where the NHS is at and supporting health boards in their response, is in less of a preventative space and is in more of a seeking to support the system in dealing with the pressures that it's under. So, Ewan, I hope that picks up a little bit of your question too.
Thank you. Kenneth Ferguson's got a question about the third sector.
Thank you, and thank you, Paul, for an interesting presentation. I'm Kenneth Ferguson of the Centre for Social Justice. We work closely with the third sector, and I just wanted to ask you what you felt the role of the third sector was in prevention, given their deep community roots and also the fact that they're so trusted as individuals and as organisations. And I wondered what you were doing in terms of supporting that role as well.
Yeah, thank you, Kenneth. Undoubtedly, the third sector has got an absolutely vital role to play in supporting community well-being, in supporting children and young people to flourish and to thrive, in helping with mental health and well-being, to go back to our earlier question. And actually, I've been struck by the fact that we do have a flourishing community health sector across Scotland, and one very practical thing that we do is provide resources to support that community health sector, the community health exchange. We also recognise the great pressure that third sector organisations are under in the current funding environment, and one of the key things that we have been pressing for, that we need to see more of, is long-term investment in prevention, because we know that we won't turn Scotland's health around overnight, and we know that with really short-term approaches to funding, there is a risk that we are reducing the efficiency and effectiveness that organisations want to have. So we would be very keen, and we are working with government on ways of supporting longer term approaches to investing in third sector organisations. Not easy. We know that some of it is about local areas coming together through their community planning partnerships to agree on local approaches, and some of it is about that relationship with the Scottish Government and how we can seek to ensure that there's accountability over the long term for improving health and well-being, rather than really short-term accountability that drives a real sort of short-term funding cycle.
Okay, thank you, Kenneth. Sally Paul, got an interesting question. Do you want to ask it?
Yeah, thank you. And thanks, Paul. Really interesting presentation so far, and some really interesting facts, I guess, which kind of relates to my question about the fact that people are living 20 years, you said, the men with ill health, and the knock-on implications of that, because obviously you can't prevent every death. And I wondered what work goes on in Public Health Scotland in relation to into not living, into dying, and dying well and grieving well.
Yeah, thank you. That's another important question. And in my year here, I have had some very interesting conversations about, for example, palliative care and what a public health approach looks like there, in terms of what might dying well look like. Our primary focus as an organisation is to see health improve and health inequalities reduce, which is why I think that probably for us and for the action that we are wanting to see, healthy life expectancy is a better measure than life expectancy overall. So we're all recognising that we're all going to die at some point, but that what we want is an increasing number of years of good health. So that's why we're focusing on the fact that, for all the health challenges that we've discussed already on this call, the wealthiest females in Scotland are still experiencing 72.3 years of good health, followed by 13 years of poor health. Whereas, as I say, the wealthiest males, 44.9 years, and then 23.7 years of poor health. So I think what we really want to see is added years of good health. And that's what we know is possible. That is within our reach through taking clear action in the areas that we've already been discussing on the call.
Okay, John Sturrock. John, do you want to ask your question?
Yes, thanks very much, Chris, and thanks very much, Paul. Yeah, Paul, I think you touched on this in the passing, but just in case there's more to be said, you mentioned other countries, and I just wonder how open we are in Scotland to learning from others elsewhere about what works well. There's a tendency, I think, sometimes in Scotland just to look inwards and to think that we have the answers, or the answers lie locally. So how much do we look at elsewhere, and what more, if anything, could be done to do even more of that?
Great question, John. Thank you for asking it. We are part of an international association of public health bodies. And in recent weeks, I've had some fascinating Teams meetings or Zoom meetings like this with colleagues from other areas. And I'm really keen, and we are seeking to take that learning, John, from other countries into Scotland. Let me just give you two examples. While we've made real progress with minimum unit pricing for alcohol, and we're one of the first countries to do that, and we've been able to share our experience with many other nations, there are other countries that are now innovating on a whole range of measures around alcohol, particularly Ireland. We can learn from them around recent measures around alcohol advertising, alcohol sponsorship. And we've recently published a briefing paper on alcohol that's available on our website, where we are arguing that we need to learn from these other countries. I was actually also fascinated to learn from public health colleagues in Kenya, where what they're doing is seeking to take a workforce that had been involved largely in vaccination, given that so many deaths were caused through malaria and other infectious diseases. But what they're seeing is what they're seeing now is what we've seen for quite a while, which is a shift from deaths through infectious disease to deaths from non-communicable diseases like cardiovascular disease, cancers. But they're taking their workforce and they're increasingly using that workforce to actually be involved in prevention. And they're taking community health workers and doing really quite progressive health checks to give people advice on whether they face particular health harms and need some follow-up. And for me, that was a lovely example of where we can and must learn from countries right across the world. We will have things to offer, but we will have things to learn. And I'm absolutely committed to remaining curious, John, taking that learning and seeking to share it, and sharing that with Scottish Government, local government and others. And of course, we've got great academic institutions in Scotland that are also taking that learning and seeking to apply it.
And that looking at international best practice, which isn't always relevant to Scotland, but can be often worth looking at, and localising in whatever way, is something, again, we're very interested in at Reform Scotland in all the areas we look at. I do notice we've got Emma Harper, MSP, with us, who's a member of the Health, Social Care and Sport Committee. And I wonder, Emma, if you've got anything to say about the issue of looking overseas or elsewhere and looking at the things that are working that might be a benefit to Scotland.
Okay, thanks, Chris. Hi, everybody. I am really enjoying listening to this afternoon, Paul, so thank you. And as a Health and Social Care Committee member and a nurse, I've been a nurse for 30 years and I worked in California. So I always look outwards when it comes to what are other countries doing. And so, and as part of the British-Irish Parliamentary Assembly, I engage with parliamentarians from Jersey, Guernsey, Wales, Ireland and Northern Ireland as well. So looking at what are they doing to train and then recruit and retain GPs, for instance. There's the same issues across the planet when it comes to GP recruitment rurally. And then I know that when Jason Leach was our chief exec, when I worked for when he was our clinical leader, Jason would talk about the NUCA model of healthcare in rural Alaska, for example. So I'm keen to make sure that we do learn what good practice is from elsewhere, because for me, like rural in Dumfries and Galloway, it takes you an awfully long time to get to Edinburgh and Glasgow if you live in Stranraer. So it is really important that we look outwards, and so I'm happy to have suggestions of where anybody thinks good practice is happening, so that then I can raise it in health committee, so that then we can use that when we take evidence and then develop our reports and recommendations for government. So thanks, Chris, for bringing me in, and again, thank you for bringing me in.
Okay, thank you for that, Emma. There you go. You know where to go if you want to put pressure on the politicians to get some stuff done. Well, we'll probably get time for one more question, and I'm going to give it to Charlie Rayburn, who has an interesting background in areas of looking at ill health prevention in a very specific way. Charlie, do you want to ask your question?
Thanks, Chris. Yeah, I come from the world of physical education and sport and trying to work with community, and I now have set up a charity which looks at sport in the community. And because I have a lot of local authority experience, I'm really concerned about how this is a huge challenge, to accept the challenge of how poor our health is. And everybody's involved, in my view, every sector. So I'm pleased to hear the boss of Public Health Scotland now talking about that. But seeing as it's such a big challenge, it does strike me we'll have to get into the education world in all its aspects, all its sectors. For example, if the world I grew up in, I trained as a PE teacher, became an advisor. But what's now being taught to the PE students of today is about performance and sports science. That's very different from when I started as a PE teacher and learned about people and about learning and about informal learning. And it goes on. And it strikes me that we have to look, because it's such a long term, when we get into the workplace, there are, for example, the Japanese have an aging population. They have done a lot of work on how can they get more productivity. So what's come out of that is that sport in the workplace, something that our country used to do, was important. I've just started reading the book about Anxious Generation, which is all about how the IT world has taken over kids. Now, these are all health issues, and so I think I'm just using the thing about education, the fact we have to change the actual fundamentals of how we teach. And then I worry, if I finish with this one, we did have initially some good working on the community care healthcare partnerships like we had in West Lothian when I was working there, but it seems to have gone wrong because of differentials in salaries and conditions. Things will be local, and there is a real need for this to be handled at local level. So I've covered a lot of territory. I appreciate that.
As always, Charlie.
Yeah. So maybe one or two little comments.
Yeah, mindful of time, I'll keep it brief, but I'm really glad you've raised the whole area of physical activity, because we haven't really touched on it on the call, and I should be more proactive in mentioning figures figures that are actually set out in the Chief Medical Officer's annual report, which I commend to you. It was published just in the last couple of weeks, have got the up-to-date figures around the harm that we are seeing in Scotland, and physical inactivity is causing a great deal of that harm. So the converse, if we're going to be more positive, is how are we going to support our children and young people, but actually all of us, to both have a healthy diet, but also to engage in physical activity for as long as we can. And I agree with you, it's not all about performance sports. And we are working with Education Scotland to explore ways in which we can seek to support them, and also Sports Scotland, really ensure that our young people are more physically active, and indeed to see this as something that goes on through life. There is some great work going on that I've been seeing recently, including through the likes of Scottish Ballet, where they are seeking to ensure that people are supported to be physically active in a whole variety of ways. We need action on it locally and nationally. It's a really important area. But Chris, I'm mindful of time.
Well, I just wonder if you could indulge me with one more question, Paul, if you've got another couple of minutes. It's just that
that's sometimes the tricky one, isn't it, when it comes right at the end?
That's right. That's the one, the guy who sat there and thought and then come up with a corker. But no, it's just an interesting question on the issue of tech, which was something we touched on earlier, and I'm very keen to take it. Paul McGuinness, do you want to have your say, Paul?
Yeah, thanks, Chris, and thanks, Paul. It was a really interesting discussion. I guess my question is, as Chris said, was really around technology and really the kind of increasing use of data and kind of predictive algorithms to help drive this issue of prevention. So really what we're seeing a lot, I think, within Public Health Scotland and so on is increasing use of kind of population health analytics, really to try and inform policy approaches to condition management. But what we're seeing in other kind of health systems, in England are starting to do this now, is actually using kind of data and AI to generate kind of predictive analytics, which can be shared with healthcare practitioners to help drive these early interventions with patients who have kind of chronic conditions. So I guess my question is, what is the kind of plan around kind of Public Health Scotland around how to use things like the SEER platform that's been developed to actually help drive early interventions at a patient level rather than just at a policy level?
Yeah, I think it's a really important area. You're right to have covered it. I've talked largely about population-wide approaches to prevention, and I think they're absolutely vital. And we can see action, and they're not that expensive in many cases. I think you're taking us to precision approaches to prevention, which is a really interesting area where we can use data and technology to give very precise preventative support for individuals. We are active in that space using our data and working particularly with the universities and indeed the Chief Scientist's Office in the Scottish Government. So I think it's an area that will need to grow very significantly, but happy to follow up on that, on any other issues. If colleagues in the call have got points that they do wish me to follow up on, feel free to send me an email and I'll make sure we can provide more detailed information.
Well, that brings things to a close, and I'd just like to thank you, Paul, for an hour and a bit that was in places quite alarming, in places had space for optimism, and in places had a bit of challenge to us all and to you, I think. And it's good to know that your organisation is there fighting this fight, which, as I said earlier, I don't envy you, but we've got to make a difference on these things, both in terms of our quality of life, but also in terms of how we can manage and afford our NHS. So there's such a lot of food for thought there, and it's something certainly we'll be returning to at Reform Scotland as our NHS 2048 programme carries on. So thank you to you all for attending. There will be more such events in the future, so keep an eye on your inbox or sign up on our website if you don't get our emails, because you don't want to miss exciting afternoons like this. And just once again, I'd like to say thank you to Paul, and yeah, we shall see you all soon.
Thanks very much. Good to see you all.